Hi, my name is Ken Cutbush. I'm a shoulder surgeon working in Brisbane. I'm going to talk to you about complications of reverse shoulder prosthesis, so the reverse shoulder arthroplasty. So the things we need to think about are infection, dislocation, possible fractures, nerve injuries, hardware complications, revision, what are the revision rates, and of course, anaesthetic issues. Reverse shoulder replacement is a life-changing operation. However, you need to keep in mind that it is an open operation, and of course there are risks associated with any surgery, and particularly with an open joint replacement. And the complications are similar to having a hip replacement or a knee replacement, so you need to think of it in that light. They're rare, they don't happen very often, they're very occasional. However, you do need to know about them. You need to take them into account when you're thinking about having a shoulder replacement performed. So the infection rate for reverse shoulder replacement in my practice is much less than 1%. And if you if you do get infection, sometimes this needs to be washed out. Rarely, the whole prosthesis needs to come out, needs to be put back in, and you need to be covered with antibiotics during that time. And that can be quite a difficult time period. So it's fortunate that's extremely rare. In dislocation, about 1% of reverse shoulder prostheses will dislocate, and the dislocation normally occur in that first year after the shoulder's been put in. After that, they're usually pretty rare. If they do dislocate in that early post-operative period, they often just need to be put back into joint, but occasionally you'll need a revision, and the shoulder prosthesis will need to be opened up, and the prosthesis will need to be usually increased in size. It needs to be, the tension of the prosthesis needs to be increased, and we do that by changing some of the components. Usually the stem and the base plate can stay, and it's the components in between that need to be put in, and with taller prostheses or a glenosphere that is more lateralized, or a bigger glenosphere, those sort of things. Fractures can occur. One of the things we do not want to see is a stress fracture of the scapular spine. So the scapular spine can fracture. After the operation, all the force of the shoulder goes through the deltoid muscle, and the deltoid muscle comes up to the spine of the scapula, and it's like a paperclip, is what I'd explain to patients. That the piece of bone coming out to the acromion, to this point of the shoulder here, it's like a paperclip. You can get a paperclip and bend it backwards and forwards, and backwards and backwards, and it will start to crack. Well, that's a stress reaction, stress response, and if it goes further, it will actually then snap. And we don't want to see that. That's around about 5% of cases get a stress fracture of the scapular spine, and it can usually be prevented, because in almost every case you'll get a warning sense of pain in the back of the shoulder at the time. And it normally comes on, it's really usually around that 3-month mark. So it's once you're out of the sling and you're starting to move, starting to go back to sport, and you're just doing too much. And you'll get the pain in the back of the shoulder. And at that time, what you want to do is to slow down and even go back into the sling for a few weeks until the pain settles completely. If at that time, when you start to feel that pain in the back of the shoulder, you push through it, that no pain, no gain sort of concept, it will generally go on to fatigue fracture and actually break. It's a really big problem if it breaks. It will generally need an operation to fix it, and the operations are not always entirely successful. So we really want to avoid it completely. The typical case example that I give of the stress fracture of the scapula is someone loves their golf. Absolutely loves their golf. They haven't been able to play golf for years because the shoulder's been so sore. At 6 weeks post-op after the reverse, the shoulder's feeling terrific, the movements come back, they go out and play a bit of golf, and they realize they can start playing golf again. They go and play every day. And it's just too much. You can play golf, but just once a week to start with, not every day. And it's that everyday thing. It's like that little paperclip bending it backwards and forwards until eventually it breaks. What you want to do is just once a week or so, because your body will adjust. The whole mechanics of your shoulder are changed after you have the reverse shoulder replacement done, and you just have to give it time to adjust. So for the first 6 months, you just need to pace yourself. And if, as I said, if it gets sore, ease off, even go back into the sling. The bone actually gets stronger, the muscle as well as the muscle. So not only does the muscle get stronger and build up in bulk and strength, the bone does as well. And the bone will adjust to take the stress that's put across it as it needs to. It just needs a few months to be able to do that. It's not like you won't be able to do these things long term. You will be able to get back to playing golf most days. just not for the first 3 to 6 months. So there's stress fractures. To diagnose them, we'll often get a plain x-ray, CT scan, and bone scan. They usually show up pretty well on the bone scan as a hot spot, wherever you get them. You can also get a stress reaction under the base plate in the shoulder itself. And again, what we do is just put you into a sling and rest up until that goes away. Remember, most of us in Queensland are scared of the sun, so we don't get enough vitamin D. And vitamin D is very important for your bones, so you take your vitamin D, take a bit of vitamin C, and of course calcium is good for the bones as well, so take some calcium. Now, nerve injury is something to think of. The nerves do not like being pushed out of the way when we do shoulder replacements, and sometimes they will play up, and nerve injury is a rare but risk that you do need to know about and be aware of. But fortunately, it's extremely rare. Hardware complications. Long term, the prosthesis can loosen. Most of these prostheses, in particular the prostheses I use, have a coating on them where the bone grows onto them, and it does need to be able to grow onto them and get solid. And that is one of the things we check at 12 months. So post-operatively, you'll see me at 6 weeks and 12 weeks post-op with one of the physios. And of course, we adapt your rehab program and right back to your physio at that time. And then I see you for a final visit at 12 months with a CT and X-ray. What we want to see then is that the prosthesis is solid, that the bone has grown onto the prosthesis, and we're sure that the prosthesis is going to be good for the long term. So that's what we do there at 12 months. Now, revision rates for reverse shoulder replacements. In Australia, currently, 80% of all shoulder replacements are reverse shoulder replacements out of all the shoulder replacements done, and out of all the options in terms of replacing the shoulder, so hemiarthroplasty, half joint, there's surface replacement, and anatomic total shoulder replacement or reverse total shoulder replacement. Reverse is the one with the lowest revision rates of all of them. And we're looking at a revision rate at 10 years of about 5%, and around at 14 years, which is what we're seeing in the joint registry, the Australian joint registry that everyone looks at around the world, with the 14-year data is suggesting around 7% revision rate for reverse shoulder replacement. So I think it's pretty reasonable to suggest to you that you could expect to get at least 20 years out of your shoulder replacement if we do a reverse shoulder replacement for you. The other thing to remember is that you're having an anaesthetic. This is a proper anaesthetic. It's a general anaesthetic. It's not a spinal that you might have for a hip replacement or a knee replacement. We can't do those for a shoulder replacement. It's too high, too close to the head. And so it's a general anaesthetic. And it is a proper anaesthetic, and there are risks of any anaesthetic. In Australia, I think we're all aware of that. In the work up to the operation, we will get you to see one of the physicians. It's surprising how many people have little medical issues they're not really aware of, or maybe haven't put much thought into, that need to be adjusted and optimized coming up to the surgery. Because that surgery is quite a stress on the body, and if there are any medical issues that are hiding away there, we want to know about them beforehand, because we don't want to discover them at the time of the surgery and be surprised by them. We'd much rather that they are all sorted out beforehand. So that's why we will ask you to see one of the physicians that comes to the hospital where you're going to be having your operation, so that they can be looked at and optimized and make sure you're in the best possible health for the operation when you come through to it. So that's a rundown of the possible complications of reverse shoulder replacement. I hope that all makes sense to you and puts things in perspective for you. Thanks for listening.